Hello everyone, welcome back to another episode of the Breast Cancer Physio. I have the wonderful Fiona Rogers back again, so thank you so much for coming back again, Fiona, because we did a video not that long ago on sexual issues, particularly in the context of how the pelvic floor tightens up after chemically induced menopause. So if you haven't seen that video yet, guys, I'll just leave a little tag up in the corner so you can go and check that out if you haven't watched that video yet, because that is a cracker. Today we're going to talk about what is a safe lubricant after breast cancer, because this is a really big issue. And again, you know, as we've discussed many times before, sexual health after breast cancer is very under-addressed. There's just not enough education out there on this topic. So we really want to do quite a big series. We discussed making a movie on this very topic, because Fiona and I have been, you know, throwing around what sort of topics we're going to cover, and there's just heaps and heaps and heaps of topics in sexual health, isn't there?
Absolutely. Yeah.
So what is a safe lubricant, and why is there an issue with the available lubricants that you can go and buy in a chemist or whatnot?
Well, I would actually even wind that back to start with. And a lot of women don't realise that they perhaps need to use a lubricant.
Well, that's a good point, isn't it?
So absolutely. Before we decide which one we're going to use. So if you're having treatment and you're on a estrogen blocking medication, which puts you into a hormonal, menopausal state, then one of the unexpected side effects for a lot of women is that they can get vaginal dryness. And we talked about that then leading to pelvic floor pain. But one of the solutions can be to use some lube. Now, a lot of women find when they're younger or pre-treatment, they don't need a lube. A lot of people like to use a lube when they are having any sort of sexual activity, whether that be with a partner or using a vibrator or a dildo or anything that you find you like to do.
Yes.
And then you find that you can't do, or it's painful to do. So basically, when you're in a chemically induced state of menopause, it's very similar to menopause, or the same as menopause, but it comes on very suddenly. And one of the things that estrogen helps is to keep the vaginal walls nice and lubricated and moist. And I often liken it to, we're told that we need to put collagen and moisturizer and everything onto our faces to stop the wrinkles and so forth. But, your skin dries out and your mucosal tissue dries out.
Yeah.
So what a lack of estrogen does is that our vagina can become quite dry, and we want to try and replace that. So women who've been through menopause will be quite aware of this. And quite often the solution there is to use a vaginal estrogen. So that sort of helps to plump up the tissues in the vagina. There has been a big period of time where that was frowned upon from oncologists with women who have an estrogen-driven
breast
cancer.
Yeah.
It seems, from what I'm hearing now, talking to the doctors, that because it's topical and it's not systemic, some of them do allow their patients to use it. So that's a conversation is very individual, and it would be a conversation to have with your oncology team. But some women will be allowed to replace that with a vaginal estrogen. If you can't do that, then using some form of vaginal moisturizer, which will then lead to using a lubricant for any sexual activity, or even just for examinations. So it can be a combination of all of those things. So when it's really no different post, what you look for in a lubricant post cancer treatment than it is for anybody, really.
Right.
So we're talking mucosal tissue. It's internal. We want to be using the most natural things that we can. So the main things to avoid are parabens and glycerol in products.
Right. Yeah.
So the more natural, the better. And there are quite a number of very well-known lubricants that do tend to still have some of those additives in them. So what you're looking for is something that's very natural and look on your ingredients list that there's no paraben. So they should be paraben free and glycerol free.
And we should also just make the point for the viewers here, Fiona. So topical essentially means it's only influencing the tissue it's immediately in contact with. That's correct, I'm assuming.
Correct,
yeah. As opposed to systemic,
Yep.
which is having an influence on your entire body. So as an example, radiation has more of a topical effect in the sense it's only affecting the tissue it's hitting. Chemotherapy, because it's going through your bloodstream, it's essentially affecting your entire body. So just to clarify, that's what we mean by systemic versus topical, because that's sometimes going to be a bit medical lingo. It's like, oh God, what did they mean by that? Yeah,
and that's when we're talking about vaginal estrogen. So, and again, the caveat that's absolutely an individual thing that needs to be spoken to, because everybody's different, and your oncology team are the ones that know you best.
And so don't go basically running out to buy an estrogen based lubricant, guys, because it would be a matter of going and making an appointment with your oncologist or your breast surgeon if you don't have an oncologist in that circumstance, and having, because it all comes back, of course, to the nature of your individual breast cancer as to where they make those decisions as to if it's safe or not. But as far as we've seen, and particularly from the scope of work you do, Fiona, there does seem to be a bit of a tide turning here, doesn't there?
Yeah. But whatever you're doing, it's usually best to be using some form of vaginal moisturiser. So that will normally be like a water-based one. There's products like the Yes VM brand. There's a lot of vaginal moisturisers out there. Sometimes it's a bit of a, try something and see if it works for you. But my advice is normally to go with as natural as possible.
Yeah.
Some women like to use even just basic oils. So using things like coconut oil or olive oil. That can be a little bit, there is some research coming out on that it may not be as good as we used to think.
Believe.
Because it can cause a coating as well. With the water-based ones, it will actually absorb into the tissues as well.
Right.
So and that can help with the keeping things, generally nice,
hydrated,
and nice and healthy.
Because here we're actually talking really about the general health of your vaginal tissues, aren't we? As opposed to lubrication during any sort of sexual activity or any time there's penetration.
But you can use your water-based lubricant for
moisturiser
as a moisturiser. But then you can actually use it as to help with it as a lubricant.
If it's water-based, so it's actually interchangeable.
Yeah.
Right.
So something, for example, like that Yes VM, which is one that I tend to recommend to my patients because it's organic, it's natural, and it can be used either way.
Right. And if you're starting to wonder where the hell you're going to find these products, guys, please, as we mentioned at the start of the video, Fiona has a fantastic website with such an amazing variety of products on there. So it's pelvic floor exercises.
Exercise.com.
Exercise.com. So not the plural. But we'll make sure we put the link to the website in the description bar below so that you can access Fiona's website.
There's another really lovely product I'll just mention, made by or created by an Australian pelvic floor physio called Olive and Bee, and it's got 2 ingredients, and that's extra virgin olive oil and beeswax.
Yes, I've heard of this one. Which is
quite an oily one, but it's just a beautiful natural. It was created with a compounding pharmacist as well.
Right.
And it's just a beautiful natural. It's really good to sort of externally around the labia if you're getting a little bit dry around there, but it can be used as a as a personal lubricant as well.
Because I must say, one of the most common side effects of hormone blockers that women will report to me that drives them absolutely nuts is vaginal itchiness or vaginal dryness.
Which is part of being a postmenopausal woman as well. So absolutely. And like when you go to the gym and you might be on the bike or using equipment, it can feel even more uncomfortable. So, and that brings up a whole other thing about we want to keep people exercising, but small things like that can actually stop a woman
from actually
exercising. So something like the Olive and Bee can be so nice just to use externally. Makes it so much more comfortable.
It always floors me how the side effects of the hormone blocking medication in particular have such a massive impact on the quality of life of the patient. Not in all cases, of course, and I'm certainly not here trumpeting that people shouldn't be on hormone blocking medication, but what I do like to preach is that what I believe is that we really need a much better support system for women who are on hormone blocking medication. If there's one part of probably both of our jobs that where we are, it's like, well, what are we treating? It is often the side effects of the hormone blocking medication is what I find, you know, from a physiotherapy perspective, as opposed to a pelvic floor perspective, you know, even just joint pain and fatigue and just loss of general conditioning. It's huge, and the quality of life impacts are significant. And when you add all of those side effects up, it can really put a female in a pretty bad place. So
absolutely, and unfortunately there's like a necessary evil, these medications for a period of time. So it's learning to manage those side effects and actually, you know, the most important thing I think is having a team around you that can, you know, and that's what a lot of this education via, you know, your YouTube channel's about, is to give people that, you know, that
access
support,
essentially,
access,
isn't it?
and know what to do.
Because certainly there's plenty of people who write into this channel mentioning that it is actually difficult for them to get access to particular health professionals or to you know, get second opinions or whatnot if they're not quite happy with the team that is around them, and certainly the impact of COVID has made it quite difficult for people to get together. So if and I'm sure one of the things we've already discussed is a little bit more interactive media, so like IGTV, so that we can have a few more sessions where people can actually shoot their questions in maybe at the time that the filming is being done. Because we really appreciate that everyone's got their own individual set of questions, and you know, like we've said, there's just so many topics in sexual health that we will cover.
We will get over.
I'm just gonna tie Fiona down to the floor in this in my office here, and we'll just keep filming. So
talking all day. And I think even just, you don't necessarily have to have an appointment with someone. If you've watched something like this and thought, oh, I haven't thought about using a lubricant, and go and buy a good quality lubricant and try that. That could be all you need to do. It doesn't necessarily mean you have to go and spend heaps of money with you know. It's just being aware that these may be an issue and that there is a solution.
Absolutely. And I think from everything I've experienced, women actually really enjoy feeling empowered by being educated on what might be coming ahead. I think it's a really frustrating thing, or certainly from the feedback I've had from my patients over the last few years, that when they get surprised by another new symptom that's related to their breast cancer, it just adds to the frustration, because if someone had educated them and just given them a little bit of warning, and it's like, you don't need to go off and do a university degree on lubricants, of course, but just as an education session, which I believe is why the Thrivership program has worked well. We haven't actually discussed the Thrivership program much on this channel, guys, so I'll do a separate video on the Thrivership program, because it's well worth sort of talking about that program. But essentially it was an education lecture series designed to empower women, more so after breast cancer, a little bit during breast cancer, but the empowerment of education is massive. But of all the topics, sexual health seems to be the one that's least discussed.
Absolutely, which is just generally an issue, and it's more that side, what's next? You know, if you keep getting hit by the sucker punches of things you weren't expecting, that kind of just drives up the anxiety and tension. And
absolutely.
That, you know, as we discussed in a previous video about you know, muscle tension, and that can be held in the pelvic floor. So it's just like this big circle of things, and if you're aware of them, it may not happen to you, but if you're aware that there is a solution, if this crops up, then I think that's, as you say, very empowering.
Absolutely relieving for the patient, So on the note of just general vaginal health on a day-to-day basis, if you're using would you recommend women who have vaginal dryness, vaginal itchiness, or just generally women who are taking a hormone blocker, would you suggest that it's just worth their while to be using a vaginal moisturiser on a daily basis?
Or daily, every second day, whatever works for them. It's a bit like, you know, what you would do with your face. You know, you sometimes can get away with a day or two without doing it, but if you're finding that you're getting itchy and dry, I would also just put a caveat on that. With itchiness, there are a plethora of other conditions that can actually require medical attention. And the least of, not the least of, but the simplest of those would be a yeast infection. And there's lichen sclerosis. There's a lot of conditions that can happen. So don't just ignore itchiness. It's a very common side effect of lack of estrogen from menopause or chemically induced, but it's also it can be something else. So it is if it's ongoing, you need to have a look. That's the other thing, ladies. Get a mirror. You might not want to, but we should all be very familiar with what we look like down there.
We're past the Victorian period, people. So get a mirror.
And you often hear of men being told to do a testicular check examination on the month. We're told to, and this is often how women will initially find out they have a breast cancer. They'll find a lump. The vulva can develop lumps. The vulva can develop skin conditions. Like there are dermatologists that just deal with the vulva. Which, by the way, is the external part of the female genitalia. The vagina is actually the internal part, but everyone tends to get that wrong and talk. So you should be familiar with what you look like and what it feels like. So just checking for lumps and regularly checking with a mirror, because any colour changes combined with itchiness, you need to go and see your doctor.
And we do appreciate here as well that because this channel is getting global attention, there'll be a lot of people out there who are from different cultures and different religious backgrounds where this sort of stuff might be quite a difficult topic. So the stuff that we're suggesting here might be completely taboo in certain cultures. So this is where seeking medical education and advice, if you have access to these individuals, is worth that step going forward. So we certainly appreciate that that can be, this could be an issue for some cultures and religions, but at the end of the day, your health is super, super important, and I think we'd always advocate that as well. So see if you can find ways around those sort of cultural barriers if that's happening for you.
And there's lots of female doctors out there who you can go to see if you've got concerns.
Absolutely. So on that note, check out Fiona's website. If you're not sure where you can purchase safe and effective lubricants and vaginal moisturizers, jump on pelvicfloorexercise.com.au. So pelvicfloorexercise.com.au, should have memorised that before we did the recording, and we'll leave a link in the description bar below. But please shoot any questions on the topic of lubricants and moisturisers to me, and I'll definitely touch base with Fiona if there's people that have questions around it. We could be inundated after these videos, I suspect, which is great because I think absolutely. You and I love bringing these topics out of the darkness and throwing ourselves at them. So all right, everybody, thank you so much for watching. I'll see you back here next week with another video. If you would like to hit the subscribe button, it is completely free to subscribe to the channel. Give this video a big thumbs up and leave a comment in the section below as we discussed. I'm the breast cancer physio, Jen McKenzie, and I will see you here next week. Thanks for watching.